Laurie Blais, can you raise your hand also, is a working ceramic artist and educator in St. Louis, Missouri. In 1995, she earned a Master of Fine Art from the University of Cincinnati and has taught at 4 university colleges, several schools, and multiple community art programs. She exhibits her sculpture in regional and national exhibitions. I'm proud to call her my friend. I've known her for many years. By the way, my name is Jim Iber. I'm from St. Louis, Missouri, and I am introducing this panel. Next panelist, Rebecca Harrison, is a certified Alexander teacher, which is the study of how the body is designed to move with efficiency and grace. Rebecca lives and works here in Portland. Her work fosters well-being and helps people be more present and comfortable in their bodies by using hands-on techniques and movement education. I should have memorized this, right? Jim Heafner, PT, DPT, OCS, earned his doctorate of physical therapy, from St. Louis University. He is a certified orthopedic clinical specialist and trained in the selective functional movement assessment. His educational and clinical backgrounds have made him an expert in manual and manipulative physical therapy, as well as functional movement. Jim lives and is the owner of Heafner Health in Boulder, Colorado. Welcomes you to come there for service, I'm sure. That's the plug. In addition, he focuses his attention on educating fellow physical therapists in the profession, teaching advanced training courses across the country. Jim is an entrepreneur, teacher, and avid writer in the subjects of physical therapy, health, and wellness. And lastly, Amy Song is a full-time ceramic artist in Plainfield, Illinois, who became certified to teach Pilates after experiencing the benefits of the exercise. Amy uses her Pilates every day in the studio, practicing simple exercises and stretches that make the studio hours more manageable. So reach behind your back, give it a rub, and welcome.
Hey, good morning, everyone. All right, this presentation is about movement, so if you feel like you need to move or you want to stand up, please feel free to do so. I want this to be a little bit more relaxed than potentially other talks, I'm not sure. But it's good to be up here. Maybe I'm the first physical therapist to be speaking at the NCECA conference. But today we're going to talk about how to make your body your strongest tool. So what does that mean? It means how to really take advantage of your body, both in the clinic and outside of the clinic, utilize the body for really longevity. And today we're going to talk about stuff in relation to your artwork, but hopefully you can take those principles and relate it back to every aspect of your life. Here are a few different objectives today. We won't really spend too much time on this, but we're going to talk posture, we're going to talk body mechanics, specifically sitting and standing during pretty typical stuff that you all do every day. Let's dive right into some posture stuff. What words come to mind when you see this picture? Yeah, God, you guys are awesome. Keep talking the whole time. All of those words come to mind, really, sadness, depression, and what that tells us is that how we move and the postures that we place ourselves in give us so much information about our external environment, how we're feeling, our emotional state. There was a great TED Talk from a woman named Amy Cuddy several years ago that looked at this relationship between posture and our attitude. She specifically looked at the hormones of cortisol and testosterone. Does anyone know what cortisol does? Stress hormone, high stress hormone. So people with high levels of cortisol have higher levels of stress. Testosterone, we all have some level of it. It is a known power and dominance hormone. Generally, if you have higher testosterone, you feel good. What this picture is clearly a low power pose. Much more likely to have high cortisol and lower testosterone. What is really interesting, the most profound thing I took from our whole talk was that blind people, even when they won a running race, they finished the race like this. They had never seen someone do this before, but they still knew this was a strong power pose. Okay, these two pictures here. Can I get a show of hands? Who thinks the picture on the left is the better body mechanics or better posture? Yeah, easy crowd, yes. All right. What about the picture on the right? Yes. That is correct. And we're going to jump into why the picture on the right is better, but then also why the picture on the left sets you up for wrist pain, neck and shoulder issues, all that sort of stuff. Can I get a show of hands Who in the audience has experienced back pain? All right, it was too quick, but I'm gonna guess it was probably about 80% or maybe even a little bit more. And what's interesting about low back pain is that 80% of people are gonna experience this at some point during their lives. And it's not like you're picking up 100 pounds of clay and that's when you injure your back. The majority of low back pain is due to an insidious onset, which means there's no direct or no attributable cause to your back pain. So it's more like you're bending forward first thing in the morning and you injure your back while tying your shoe. And as a healthcare practitioner, that is not a good thing. If you can't perform a basic functional movement like forward bending without hurting yourself, that means something seriously is going wrong with the system. Next, 33% of people are gonna have a second and third episode of low back pain. So they're more likely to have these recurrent episodes of pain. And then to show the societal burden, low back pain is the second most common reason that people miss work. Second, can anyone take a guess at what the number one reason is? Yeah, the common cold. So it's second to the common cold. This is a huge societal burden. More specifically in the artist population, a lot of people have wrist and elbow pain. The muscles around the elbow become overworked, overused. It's often called tennis elbow or elbow tendonitis. It leads to pain and disability, and similar to low back pain, many artists miss work because of the wrist and elbow issues. Now, why are so many people dealing with these problems? And that is really what we're going to jump into today. This is what brought us here today. Laurie, who I'm giving the first half of the presentation with, she's my aunt, my godmother. She began experiencing right shoulder and arm pain about 6 years ago. Now, for her, it's important because she's right-handed. As a right-handed individual, she can't do her artwork, she can't do her work as a teacher, and it really began affecting all aspects of her life. So as she was going through physical therapy, we began talking about the different positions that ceramic artists have to put themselves in on a daily basis. That includes wedging, wheel throwing, and these are tough, demanding postures. We concluded that if she was dealing with these issues, likely, and especially from the show of hands that we saw, probably the majority of people in the ceramic artist world are also suffering from similar problems. So with Laurie's example, I used a few keywords. Those words, number one being pain, the second one being posture. Pain is a complex thing. It's a good thing though overall. It's our body's natural defense system. About 30 years ago, there was this huge mantra of no pain, no gain, we can push past anything. And I want everyone to completely dispel that. No pain, no gain is really not the way to go anymore. Pain is your body and your brain saying, hey, something's going wrong, and you need to really appreciate that. It can be defined as acute or chronic pain. So acute pain is a quick amount of pain, generally lasts less than about 3 days, and then chronic pain lasts typically 3 to 6 months, so much longer onset of pain. With acute pain, it would be like me walking down the street and I stub my toe, and then when I stub my toe, a quick signal goes up to my brain. My brain says, hey, you've stubbed your toe. You've stubbed your toe before. Everything's okay. The signal goes back down. You remove your foot from the stimulus, shake it out probably. You feel better, and you keep going on with your day. With chronic pain, you're walking on the street, you stub your toe, but instead of removing yourself from the stimulus, for some reason you decide to stub your toe over and over again. It doesn't seem very smart. But a lot of people, and this is what these different prolonged positions that we put ourselves in, it's kind of like stubbing your toe over and over again. So with chronic pain, as you stub your toe repetitively, instead of it being a quick stimulus, your brain says it's okay. Now your brain says, hey, something is going wrong, and we don't know how to address that problem. And then next time you stub your toe, you say, well, last time I stubbed my toe, I couldn't walk as well. And when I couldn't walk as well, I had trouble getting to work. And when I had trouble getting to work, I couldn't provide for my family. And all of a sudden, it becomes a huge issue where every time you stub your toe, it's much greater than just a quick stimulus. The other word I talked about was posture. And posture is placing the muscles and bones in an optimal position to prevent injury over time. In the picture on the left, you can see everything is pretty well stacked on top of itself. The head is over the shoulders, shoulders over the middle back, and hips are right in line. And then in the picture on the right, clearly part of the body is falling forward, the head starts to tip forward, and you can see the increased curvature of the middle back, which is such a common poor postural position. But why does poor posture lead to pain? And the best way I can describe that is using this equation here of prolonged postures plus repetitive activities lead to this accumulated stress, or these microtraumas. And the example of a prolonged posture would be sitting and wedging for 20 minutes at a time without changing positions at all. So you're putting yourself in a prolonged position. Next one is repetitive activities. And these I often think of as unilateral or one-sided activities. So it would be loading the kiln only on the right side over and over again. And it creates an imbalance side to side. That leads to these repetitive microtraumas. Microtraumas are small amounts of stress over and over again. Unlike a macro trauma, like if you've ever had anyone who's torn their ACL or torn a ligament, usually it's due to a quick, high-velocity injury. Well, that's macro trauma. Microtraumas are small stresses over and over again. Leads to wear and tear, and eventually the body and brain become desensitized. I was recently working with a woman who was a hairdresser, so she stands and sits all day long, and part of her outfit is wearing about 4 to 6 inch heels every day. Now, she came to see me for both low back pain and pain going down her left leg. What's interesting is that she said she feels better when she wears 4 to 6 inch heels, and when she's barefoot, that's when she has the most pain now. And what that tells me as a healthcare practitioner is that she's become so far removed from what the normal situation is, because I hope she wasn't born wearing 4 to 6 inch heels. So she's come so far removed from that situation that now wearing heels is painful, but then also being barefoot's painful. So she's kind of lost in the middle. And it's my job to gradually get her back to a position where she doesn't have to wear that high of heels, which is really what's causing her problem. So my patient needed physical therapy because eventually she had so much micro-traumatic stress that she had to come in, we can say, for a tune-up. And that's an easy way to relate the body to needing tune-ups is to think about how a car would need tune-ups too. And part of a car's regular maintenance is gonna be getting the oil changed. So if you have a standard car, probably every 5,000 miles you need to get your oil changed. Some of the younger artists out there, you can say, well, you know, I use synthetic oil and I have a newer car, so maybe I can wait 7,500 miles. But overall, you still need to have this regular maintenance and regular tuning of your car. What happens though is, let's say at 5,000 miles, if you fail to get your oil changed, does the car break down at 5,001 miles? No, we know that if you wait till 7,500 or you wait till 10,000, there's gonna be more and more stress gradually placed on the engine. And the human body works the same way. It can tolerate stress. It doesn't break down immediately, but it's the small amounts of stress at 7,500, and then it increases at 10,000. And we need to be doing regular maintenance, I say daily maintenance, where we're putting ourselves in good positions, doing corrective movements after we're putting ourselves in these demanding work postures. Now that also includes having good nutrition, getting good sleep, but today we're really gonna focus on the artwork perspective and the different corrective exercises you can do after you're performing your art. So let's do a few posture tests as a group here. First one, I want everyone to take your right hand, bring it out in front of you, turn your thumb down, all the way down, and then raise it up as high as you can. Just kind of appreciate how that feels there, and back down. Now thumb up to a neutral position, raise it all the way up again. Which one of the positions felt easier? Hopefully, there's gonna be some people that say the first one is, and also if you're having any pain, don't do these because I don't want to be responsible for that. But thumb up should feel easier, and because the thumb up literally places the shoulder joint in a better position for movement. Many artists find themselves in this position, thumb going down, it closes off the shoulder joint, and that can become quite painful in a lot of people. Second posture test, I want everyone to slouch down in their seat, a position I don't typically recommend, and then raise both arms up overhead with your thumbs up in the air. Okay, appreciate how that feels, bring it back down. Sit up real tall, and then raise your arms up again. Power poses. Which one feels better here? Again, the second one. The reason, and what's most important about this example is that the only thing we're changing in this test here is the position of our middle back. So by changing the position of our spine, it directly affects how much motion can occur in the shoulder joints. And it's such a simple way to say the whole body is connected, and by improving the position of my spine, I can change the position of my shoulders too. I get this question all the time from my patients, and that is, what is the best posture that I can be in throughout my day to minimize stress or minimize injury over time? The best posture truly is a dynamic one, which means there's going to be regular position and regular positional changes and regular movement throughout the day. So they say, well, I'm working for an hour straight. What's the best thing I can do for my posture? Stand up. Stand up, walk for a minute or two, get some blood flow throughout your whole body. That's truly the best thing that you can do. So a few posture basics is that movement is going to be better than rest at any given time. When you're sitting here, think about having optimal posture or putting yourself in that best position where the muscles and bones are aligned. But we know optimal posture isn't going to be attainable at all times. So when you're working, have the best posture possible, and that's what we're going to talk about in just a moment. And then we know that even the best posture possible is not attainable, so doing corrective movements or utilizing muscles that are going to reverse the effects of certain postures is really important. And then finally, always think about quality over quantity of movement. There's going to be a tendency to say, well, Jim said I should do these corrective movements, I'm just going to quickly get them out of the way. You're actually going to be potentially doing more harm than good in that situation. So let's walk through an artist's workday, and we're going to talk about the different activities that you all have to do on a daily basis. And for that, I'm going to bring up Laurie Blais to the stage, and she is going to start talking about the wedging process.
Thanks, Jim. I'm going to let you control that. So I want you to talk, I've been working in clay since 1983. I know I don't look old enough to do that, but I want you to think about when you go to your studio or when you're going to the university or whatever, you always think about the clothes that you're going to wear. You might think about the shoes that you're going to wear, even what you're going to have for lunch. But when you get to the studio, some people stop thinking about what their individual needs are. And so what you need to do is think about the height of the table, the height of the wheel, and your work surface, okay? So we're gonna talk about the height of a wedging table. And so we're gonna do this almost like air guitar. We're gonna do it all imaginary. Just imagine the table is right here. So I want you to think that the table should be lower than what your work surface is. If it is up here, you're not gonna be able to use your whole body. So you wanna think that it's about your pelvis height so that when you're working, you're actually using the momentum of your body to go in this motion, okay? So what can you do? Maybe you, if you can't lower the table, maybe you raise yourself up. Find some wear boards. Maybe even find one of those plastic like exercise steps that you could use. Think that you can have that there. When I took a wood turning class, the wood turning was right here. Well, that didn't work for me because I was like always like this, and of course it made my shoulder hurt even more. So I found a little step. It raised me up. It was like perfect. So think about being an advocate for yourself physically. The next thing I want you to think of is which position works the best. So hopefully you've picked the right picture. So the picture that's on the left, what I'm doing is I'm really compromising. I'm only going to use my upper body when I'm wedging in that position. When I go to the next position, I have definitely changed my stand. So my one foot is forward, my one foot is back. But what I'm not doing there is my shoulders. I'm not activating my shoulders, and I'm really putting pressure on my wrist. The one that's on the far right, I'm actually going to use my whole body. And starting with the whole body is starting with the core. So what I thought I would do is have Jim explain how you can find and activate your core before we go on.
Now, the core muscles became really popular about 10 years ago, where everyone loves to do core strengthening, and everyone wanted to have a six-pack. And the six-pack is only really the outer core muscles. What's most important is that we know how to activate the deeper core muscles, specifically one called the transversus abdominis. And that deeper abdominal layer, it's so important because it literally feeds around into your back and helps protect your spine. So having a good idea of how to engage the transversus abdominis is going to really help save and protect your back as you're doing different activities. So the group activity here, I want everyone to take your index finger and middle finger, put it on your belly button, and then go about 2 to 3 inches out on either side. Okay, from there, just sniff or cough. So sniff or cough 3 times. What you should feel is the stomach draw in quickly. And that quick draw in is the deeper abdominal muscles working. Has anyone ever laughed so hard where the next day, like, everything is so sore? Well, it's not like you're only using your rectus muscles. You're using those deeper abdominal muscles, and that is why the soreness is occurring. So one more time, I want everyone to cough and then hold in that position there. So that abdominal muscle, you're not really losing any height here. You're keeping good length. That is the transversus abdominis, which should be activated both during sitting and standing activities. We all know how to activate it when we're sitting here now, which is great, but what's more important is how do we keep this muscle engaged as we're going through different activities. As you can see in the picture on the left, as I'm bending forward, my spine is rolling off of the board. And what that means is I'm crunching down and a lot of extra stress is going across the back. That can be likened to if I was to bend forward and lift something up, am I using my legs or am I using my back? And in the picture on the left, clearly more stress is going through my back. Now in the picture on my right, the abdominal muscles are engaged and I'm moving from my hips. So I'm using a different area as the center of movement. So as Laurie was talking about with the height of the table, make sure that it's there and then your movement can come from your hips while you're still keeping good length through the trunk.
Full body movement. So what I said, so start with your core, activate that. I need you to think then that you're going to have 1 foot forward and 1 foot back because you're going to use this rocking motion to propel the clay forward. You don't want to use your shoulders to push like this. First of all, it's exhausting. Second of all, it's going to hurt your wrist. But when you get finished wedging, you should not feel exhausted. It should just be like almost a meditative process. So foot forward, foot back, use this motion. The front leg, and it doesn't make a difference which one it is going to bend, and the back leg, I'm going to use it to push off of. Okay? So the things that you want to avoid when you're wedging is the idea that your head is going to come forward. So in the next slide, when you see that my head is down like this, your head weighs 8 pounds, okay? You know what you're doing. You've seen that. Even as a beginner, you can see the clay out here because it's not supposed to be close into you. It's going to be farther away. So don't put your head down because then it stresses all the muscles in your back and your shoulder. The other thing is when you're pushing forward, a lot of people think that you're using your biceps and this motion, you're pushing. In reality, it's this motion where you're going to roll your shoulders back. You should feel it down here and in your triceps. So it's this motion. So I'd like everybody to take your hands out in front of you, and I want you to think about that you're holding a ball of clay. So the first part, where are you going to put the pressure on the clay? It's actually this part of your hand. You should feel it in that motion. So when I'm wedging, I'm squeezing in, I'm pushing forward and coming back. And as I'm coming back, I'm spinning the clay inside of my hands. So it's this motion. And when I do this, where do I feel it? I feel it right here. I don't feel it here in my shoulders. When I started working in 1983, basically the instructor was great. He said, this is what you do. He showed us a few times, and then he left the room. You just like figure it out on your own. I'm like, okay. So that didn't really work very well for me. So you need to think about what can you use, how can you use your whole body? So what I want you to think about when your hands, no, too far. Okay, so this idea of pushing even in this, we put ourselves into compromised wrist positions all the time when we're working on the wheel. The less you can do that, the better it is. I've never been able to spiral wedge in my life. For some reason, I always put more air into the clay, and the process is to de-air the clay. So this idea that when you're doing this motion, even watching my hands in the air, it's gonna put a lot of pressure on your wrist. I'm not saying stop spiral wedging. It might be your routine, but try the ram's head way of wedging, which is the process that I just did in the air with you. Because instead of having my hands flat like this and pushing and adding a lot of tendon pressure to my tendons and the pressure on my elbow, I'm actually having my hands parallel to my body, so they're this way, just like that exercise when you took your arms up like this. Think about what your thumbs are doing. So you want to have your hands like this, and I'm keeping the power in the back of my body and not in the front of my body. Does that make sense? Okay. So try to avoid this position. So remember that wedging is a full body experience. You're going to use your legs, you're going to use your core, you're going to use your arms, and you're going to use the back of your body to do this. And have a table that is at a lower height. Okay, so a few exercises that you can do after wedging. A lot of people, and I especially see this when I was teaching, they would wedge and then they would do this, okay? Well, that feels good for a little while, but that's really not doing anything for you. So there are 3 pictures, and hopefully you know the 2 on the right are the incorrect ones. The reason why they're incorrect is I'm actually pushing my shoulder forward, and I'm pulling on my fingers like this. I'm in severe pain right now. Not a good thing to do. If I take it and I pull my shoulder back, just roll it back, lay it down on my back, hold my hand out, pull not from my fingertips, but actually from my palm, that's a much better stretch. And you don't have to do this for a long period of time. Maybe it's like 3 seconds, and then you do your other hand. The other exercise that you can do is the reverse of that. So instead of taking your hand up like this, again, roll your shoulder back so that it's down, and take your hand and lightly push this way. So then it's actually stretching and relaxing the muscles on the other side. So what happens is because you're like this all the time, these muscles, tendons, get short. You actually want to do the reverse. So this actually helps lengthen it and relaxing it. The next exercise is something that Jim showed me how to do, or actually talked to me over the phone. And he has a great website. I actually watched a video on how to do this exercise. I could not do this about 9 months ago without being in severe pain. So you take your hand to a table, and you just literally going to roll your hand forward with a straight arm, and ideally you should be able to have your hand completely flat on the table. Now, before when I did this, I literally could not do more than that. And now I can do more. If Jim does it, it's amazing. His wrist goes completely flat on the table and with no pain at all. But I have compromised my wrist mobility, and so I'm actually gradually putting that in. And the word gradually is an important exercise or important key word. I'm going to have Jim explain one more exercise before we go on to the next thing.
Has anyone ever done yoga before in the room? Yeah. And so the cat-cow is a common movement. And you have to do that, typically you're on your hands and your knees, so this all-fours position, which probably is not realistic in the studio. You can't, I highly recommend it. If you feel comfortable doing that, you definitely should. But a simple thing that you can do when standing or sitting is going to be it's the cow motion of the exercise, where you're lengthening into extension from your spine. As we talked about earlier, a lot of people tend to fall into this forward position where the middle back really starts to round. This exercise lengthens through here, opens up to the chest. Now, let's do this as a group. I want everyone to draw in the abdominals like we talked about. You shouldn't be holding your breath as you're doing it. I'm doing it right now, and I'm not running out of air. From here, draw in, hands across your chest. Keeping this, I want you to lengthen through the upper back, and then relax. Now, if you are part of the audience that's feeling this down into your low back, it means you're likely overextending and overarching from your spine. So tuck in, and then arch up through the mid-back, and the cue would be as if someone is pulling the front of your shirt up into the air, lifting through your chest. So in review, the cat-cow and the wrist stretches are great, and then additionally, a simple movement that everyone can be doing at all times, this is one I frequently do, is just a chin tuck position. Now the chin tuck is very important because many people, as the shoulders round forward to look up at the clay, they overextend their head, and then the muscles in the upper neck get very tight, which often leads to headaches and pain. So that upper neck tension can be reversed simply by changing the angle of the neck and putting the neck back into its original position. When we talked about proper posture earlier, that's this position here. So give yourself a chin tuck. Imagine that you're pressing the back of your head into a surface, turning, if there was a nozzle going through my ears, turning through the ears and staying long. Very simple one that you can do. I recommend doing that and the seated cat-cow 10 times an hour when you know you're going to be working in a forward flex position.
When you're working at hand building or at a table, think about things that make it comfortable for you. Everybody's different. Everybody's a different height. You know, maybe you're longer waisted or shorter. You just need to think about what's the most comfortable for you. And changing that position a lot. So think about that when you're working, like, so I taught high school for 18 years. That position that's on the right, all of my students wanted to be in that. And then they would complain, oh, Miss Blais, my back hurts, or, you know, and all that. I would be like, it's because you're slouching at the table. The picture that's on the left, I'm actually activating my core. I'm thinking about how, even though my head is slightly tilted down because I'm starting to make a pinch pot, you need to think about, I'm going to do that for a few, maybe minutes, and then I'm going to have to stop, and I'm going to have to readjust. I did a workshop at Anderson Ranch, and I make these three-sided ceramic forms. Well, a lot of the time I'm like this, you know. Well, by the end of the day, after my 12-hour day at the studio, I could barely move my head because it hurt so bad. So taking those few minutes, making a pinch pot, just relaxing, putting yourself in a different position, and then starting to work again is a much better thing. A lot of us tend to think, I'm just going to work and work and work and work, and I'm going to get it done. Okay? Well, that's a great attitude, but that really, our bodies are not machines, and we need to take care of that in that way. So let's talk about wheel throwing now. When you're going to wheel throw, you want to use your whole body. It's a whole body experience. So we're going to talk about the height of the stool and the height of the wheel. Ideally, when you're sitting, you want your hip and your knee to be in this angle. You don't want to have your knees higher, and you don't want to be sitting too high so that you're putting a downward pressure. So we got a stool from NCECA. It's not an adjustable stool, so I need to figure out how to make, I find the most comfortable part for me to get my leg in that position is to sit with the chair about the same height as the wheel head. If it is lower, my knees go up, I can't use my back, and I'm using more of my upper body, just my shoulders. So, what could I do? Putting several towels on there is going to help it raise it up. When I first was learning how to wheel throw, the studio I was at didn't have anything. I sat on telephone books. For some of you, we had lots of telephone books around. And I had 2 or 3 telephone books. Other people actually raised the wheel up or raised the stool up so that there are bricks or boards underneath it. So just think about it. But of course, always be safe so that you're not sliding off of anything, okay? So then when you're going to sit down at the wheel, you want to use your core. You want to use your whole body. The farther my stool is away from the wheel, the less strength I have. I like to actually sit with the wheel, the chair, the stool, as close as I can to the wheel. Then you're going to sit down and you want to use your leg muscles. Where you're going to bend forward from is not your shoulder. I'm not going to curve forward like this. I actually want to think that I'm going to take my sits bones, your pelvis bones, and I'm going to push forward and tilt on them. If I didn't have the towels, I would actually feel that bone kind of rolling forward. So how do I use my arms then? What I want to do is take my left elbow and put it on my iliac crest. So if you feel like your pelvis bones, they're up here, the top of your pelvis bone is actually your iliac crest. So that's what I'm going to do. So when I move forward, I'm going to do this motion. I'm not doing this motion. So my left hand is anchored on my pelvis. My right arm is going to tuck in like this. And I'm going to then push the clay So let's talk about hand movements. When I do this, when you look at my hand, I'm pushing from this part. I'm not pushing from my wrist. The more that your wrist can stay parallel to the wheel head, the better and the stronger you will be. The more I take it, and I see lots of people doing this, they think, and this will be really painful, so I won't do it for very long. They push like that with their wrist cocked. That's really uncomfortable. Sure, it works. And when you're wheel wedging and you're going like this, you come up, think about how instead of overextending your arms like that, that they're actually on the side. The more you can keep your hands parallel to your body, the stronger you will be. And so the same thing, I'm not cocking my wrist like this. I want to think that my hand is going to go down and my wrist is going to stay parallel. So after I wheel throw, and I usually think about 20 minutes per piece. Okay? One, you get tired, the clay gets tired. Maybe you can do it 25 minutes. Okay, it's such a cool thing. I'm making a beautiful bowl. I'm going to work on it for 30 minutes. But 30 minutes is really overextending it. After I do that, I'm going to take a few minutes. I'm going to relax. I'm actually going to roll my shoulders back. I'm going to reactivate my core, which I should have had the whole entire time when I'm working, that core is just part of you. So I want to think that I'm in this position. I'm going to take my hands and I'm going to put them on my side. And then I'm going to actually take with my thumbs pointing forward towards the wheel. I want to rotate my arms out really slowly. I want to do this 3 or 4 times. I'm talking, so obviously I'm not going to do my breathing, but literally it would be like this. Exhaling. That's relaxing your body. You want to think that the more you can take a minute to readjust, to relax, and it's literally 1 minute that you'll be doing this. The next exercise that you want to do is that you want to do the shoulder. It's shrugging your shoulders. A lot of people do this, but as you shrug up, breathe in, and then as you exhale, roll your shoulders back. Do that 4, 5, 6. If it feels great, do it 10 times. If you don't think that it's, you haven't, it's not going to take that much time. The other thing that you need to do is think after you've done those exercises, and you can do the shrugging of the shoulders sitting, or you can do it standing up, get up and move. How many times was I a potter? Or how many times do you see people that have 3 or 4 balls of clay here, maybe 8 or 10, because they're just going to be so productive. And they're going to sit here for 2 or 3 hours, and they're just going to get this all done. Have those balls of clay across the studio. Get those balls of clay. Get up, move around, get your hips moving, get your body moving. You're not a machine, even though we think about it in that way. We want to think that the part of the being productive is allowing your body to relax in between your stages of working. So I would like Jim to do our conclusion.
In conclusion, hopefully for the first half of the presentation, we gave you a good idea that your body is your strongest tool as long as you're using your body to your advantage. Listen to your body. Those moments where you say, is that uncomfortable? Is that painful? Likely something's going on where you do need to change the position and bring awareness to that. Also, be patient when trying these new techniques. It takes about 30 days to build a habit. When I was learning to engage the abdominals or keep those muscles active, I didn't just do it 3 times and I was better. It took consistent work to build those habits. And then finally, move as often as you can throughout the day. I work with a lot of people of all ranges, and what I find is those ones who tend to do worse as they get older in life, it's because they stop moving. All of our tips and resources can be found both on our presenter view and then also on both of our websites here. So if you ever want to print them out for your own clinic use, please feel free to do so. Next, I'm going to pass the mic over to Amy and Rebecca. Thank you all very much.
Thank you, Laurie and Jim. We're just going to move the wheel a little bit back. So for the second segment, we're going to be doing quite a bit of both movement demonstration up here, as well as a little bit of movement for you. So some of the movement, we're accommodating the stage a little bit here. So some of the movement is actually going to be on the table, laying on the table. So the farther forward you can be, and probably the farther to this side you can be, the more you're going to see. So you can feel free to either move now or move during to kind of see better. So we're going to kind of continue through the studio day. They talked about wedging and wheel throwing. And we're going to talk a little bit more about wheel throwing, as well as sculpting and handwork, and a standing wheel, as well as loading kilns. But I'm first going to start with a few movement ideas that we're going to build on for all of those other activities, right? So I'm going to show them and also have you do them. So the first one, I'm going to have Amy come up here. Remember that exercise that Jim had you do where you kind of slumped down and then you raised your arms and it was really hard, right? And then you got a little bit longer and you raised your arms, it was a lot easier, right? So I'm going to show you one of the reasons why that works. So Amy, if you turn to the back, so your back is facing them, and go like nice and long, right? So our arms, we usually think of arms as being what I call sleeve arms, right? This is my arm, right? But if you look at the arm muscles, meaning all the muscles that directly move your arms, everything that you see from the base of her skull, covering her entire back, all the way down to her tail, everything, all of that is direct arm muscle, right? At least the first layer, in some cases, more than one layer. And if she turns around, ta-da! In covering her whole ribs in front is also direct arm muscle. And to the side, spiraling around the side of your rib cage is also direct arm muscle. So when you redefine your arm as really, it's your entire back, it's this whole part of your chest, and it's this underside of the arm, it starts to make a whole lot of sense why if you either kind of overextend, right, like make yourself super straight, or if you slump, that you totally cut yourself off from a huge percentage of the muscles that are actually designed to support you, right? So the first thing that we're going to show is one of my favorite ways to help us to get into a more neutral spine and torso. So I'm going to show it first because it involves looking up to the ceiling, so it's hard for you to do it and kind of see it at the same time. I'm going to show it first, right? So let's see, I find myself during the studio day and I'm getting a little tired, right? What I do is I let my eyes look all the way up to the ceiling, which means that my head is going to have to rotate and get on top of my spine. And then when I want to look forward again, rather than kind of bink, letting my head just kind of drop forward, right? I let my eyes look all the way up to the ceiling, and I put one hand on my nose and one at the base of my skull, and I let my nose come down and the kind of low ponytail level come up, right? So I'm going to show that again, and then we're going to do it, right? So if I slump, right, or if I'm here, doesn't really matter. You just find yourself in the day, and you want to have a little bit more support. You let yourself look all the way up to the ceiling, and if you see, if I'm starting slumped, right, and I look up to the ceiling, not only does my head move, but can you see that how my whole spine and back kind of want to unfold with me? If you let it, and then in order to rotate your head, you let your nose come down and your low ponytail come up, right? And then if I want to look down, don't want to fall off the stage, right? If I want to look down, rather than jutting my head forward, I simply let my nose come farther down and my low ponytail go farther up, right? And then I can totally see whatever I might need to see either on the floor or my workpiece without compromising this big support. So move just slightly forward in your chairs. Cool. Now if you slump a lot, this is actually going to be quite a bit of a stretch. So what I recommend with these is that when you do it periodically during your day, don't hold on to it. Right, do it for a while, so let's do it now where you let your head look all the way up to those cool circular lights up there. And then when you rotate, and it can help at least at first to kind of feel the landmarks, nose and ponytail, right? You're gonna let your nose come down and the back of the ponytail come up. Great. And then you might hang out here for a while, and then you might, find yourself falling back into something, and then you just redo it. And one nice thing about not holding on to it is that it actually helps your muscles stretch, right? So if I'm kind of like a Gumby all during my day, right? Because our bodies really hate holding on to things. So it's actually okay to fall back to what you've been doing. And every time you do this new thing, things will start getting stretched and used to it, so that after a while, it's less and less and less of a stretch, and it just becomes kind of where you hang out. Okay, so that's number one, head ponytail. It's great just throughout your day. The second one is something about, well, okay, here we're nice and we have more neutral, we have a stronger back to help support our arms, but how am I going to move? I could just kind of do like this all day, right? Just not move anything, but that's not going to work very well. Right? So what we're going to feel is one of the movements that our spines really, really like is a spiral, right? So right now, if you feel inside of your body, and imagine that there's like a column or a pole, right? And you're going to feel from inside the ears, and then down the throat, and down the torso. And this column is central-ish in your body, down the lower torso and down into your pelvis. Right? So everyone have that? It's kind of like a barbershop pole, right? And then come forward enough in your chair so you can move, right? So we have this beautiful column or barbershop pole inside. And then in order to spiral, you're just going to move around the pole. Right? So in other words, what I'm not doing is I'm not lifting up somewhere and I'm not collapsing anywhere. Right? I'm just going right around the pole. Now, this starts coming in handy and making a lot more sense for clay when you put your arms with it, right? So if everyone has their arms in front, when you have the spiral in your arms, remember how the arms are linked to the back and to the front, right? So when you need to spiral your hands, your torso can also be spiraling. In fact, it would like to. I'd like to do some of that spiraling with you. Yeah. Right. Cool. Okay, number 3. That's great. Now we're going to have a lot more range with torso, right, with a lot of support. But what if I need to get down? Right, kiln loading, looking at a piece lower. How am I going to get down? Well, what we usually do is this. Oh, I just need to get lower. Wink. I'm lower, right? And the only problem with that is, I've lost the support from my torso to my arms. And you're going to end up, especially if it's with heavy lifting or just accumulated over time, you're going to end up with back, shoulder, other issues. So what really, 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 really likes to help us get up and down is our legs. It really likes it, right? So we're going to find our joints. We have 3 big joints in our legs. One is the hips, and the hips are low and inside. I'm talking about the joints rather than kind of these big bones. The joints are low and inside, so if you kind of fold forward in your chair, it's where your fingers kind of fall in the crease the most, right? So that likes to send you back, just like Laurie said, how the sits bones are going to feel like they're rolling back in the chair. That's because these joints are moving, right? And then we have 2 other joints. Your knee joints are just below the kneecaps, so a little bit lower than we usually think, right? And the ankle joints are about 1/3 of the way forward in the foot, just in front of the heel a little bit. Great. So what these joints like to do is work as kind of like a trifold. So if you think of like a trifold ruler, right? So if I want to get closer to the floor, I get to be like a monkey. I like being like a monkey. So my knees go forward, and as my knees go forward, that hip crease goes back, and my heels go back. And this way, look, I get a long torso, right? I haven't dropped my head forward. I still have a total support for my arms, right? Now this is cool, and I have some clients who really don't like looking like a monkey. I like looking like a monkey. Well, let's do this. Let's actually do this first. So come forward in your seat enough. Great. And then what you're going to do is you're going to let one foot just a little bit in front of the other, so just see it's easier. And let yourself come forward in that hip crease just enough so that the weight starts getting onto your feet. And when it does, you're going to feel your hips, knees, and ankles push you up to standing. So you're going to come forward and push up to standing. Great. And then in order to get down, right, your knees release forward, your hips go back, and your ankles go back. So what a lot of people don't want to do is they're kind of scared to stick their butt out. Like, oh, I'm doing it, see? But really, if you do that, if you don't do this, if you don't let your hip pelvis go back, then your ankles are actually really tensing and you're tensing your back. So this time we're going to do it one more time. Come on up, and this time let your torso fold you back. So your sits bones are going to come farther back. Cool. So that's the basics of all up and down movement, but then of course we have a lot of variety with those 3 joints. Right? If you think more like tennis players, you can end up doing kind of side-to-side motions, forward and back motions. It's a lot of like variations on squatting and lunging. But the idea is you're using those 3 joints without compromising your torso. So we're going to apply a few of these to the wheel, and Amy's going to come up. So she's just going to kind of show some of the things we just talked about. So she might do that nose ponytail thing, where she lets herself look all the way up to the ceiling. Back of the head comes up, right? And then in order to come over the wheel, she's going to use those hip joints. And the sits bones are going to roll forward, like Laurie was talking about. Great. Now, if she wants to move from here, which you probably do, right? I would think. If she's going to do like a centering motion, she gets to find that barbershop pole. So she's going to do just that a few times, and you can see, why don't you do one where you're collapsed? Boom. Collapsed and spiral. Right? It's a spiral, but see how she's blum, right? Instead, she's going to keep herself long and find a spiral in her torso and head and use that to support her arm movement. Cool. Great. And Amy's going to talk about a couple other things that can be helpful at the wheel.
So, Laurie was talking about having the cushion at the seat, and everybody's bodies are different. So I'm going to suggest or talk a little bit about a wedge at the wheel, because I found that to be extremely helpful. And let me show you what I'm talking about. So if you're sitting at the wheel and the wheel is parallel to the floor, a lot of times your body's going to want to curl over the top and then to get to the clay. And so when you...
I'm going to take your necklace off just so that it's not...
Thank you. So that lower back really wants to curl over top of the clay to access it. And so what I found to be extremely helpful is, and this is actually from my friendship with Rebecca, I was asking her about my slumped posture. And she said, well, why don't you just put a little cushion under your tush? And then immediately, my back posture is really straightened up, and very helpful. And then the application at the wheel is that I find that brings up my center of gravity, and it also means that I'm leaning forward into the clay with more of that pelvis strength, and that I can hinge forward with the flat back and get into the clay that way. So every body is different. I would try a rolled up, towel and see how you like it. And then I absolutely love the Relaxo-Back one. A PT found it for me. It's washable, and it has lasted very long. So I have that at the studio where there's a lot of different wheels. And then I have the Shimpo stool at home, which is the same idea. The Relaxo-Back is awesome for if you're kneeling on the floor and mixing glazes and things too. So just something that you can find at Amazon. If this is something that you find to be helpful, because again, everybody's posture and body is built a little bit differently. So. All right, so all of this lovely talk about body mechanics and such, let's walk through a little gyrotonic stretch. So this is also cat-cow, and this would be, let's see, let's actually rotate it this way. Thank you. And sit with your knees that way. So here's another variation with more of a full spinal curl. So Rebecca is going to demonstrate, and let's go ahead and watch her for the first round of this, and then feel free to join in. So what she's going to do is she's perched a little bit forward in the edge of the chair, and as much as you can. I was glad to see that these seats are a little bit wide. So go ahead and have your hips wider than hip distance as much as you can. Get close to your neighbor. And she's going to imagine that there's a wall behind her and that she's in a pool of water. It's very relaxing. And so what she's going to do is she's going to nod her head down, and she's going to start peeling the vertebrae away from that wall behind her, one vertebrae at a time. And then she's going to dive down into that water, and then she's going to curl and then come up on up for air. And then she's going to go ahead and straighten back up. So go ahead, and if you would like to join, just go ahead and nod that head away from that wall and dive deep down under that water. Go ahead and go all the way down, then reach up with that head. And let your lower back now start to pull that belly button back, really curl that lower lumbar spine backwards, get a nice little curl in there. All right, now she dives up this time. What she's going to do is she's going to pause, and she's going to reach forward with that diamond pendant that she's wearing, and she's going to go back under the water, and she's going to curl up and stack those vertebrae, one vertebrae at a time, up. And again, reaching towards that floor with the chest, and coming on down and curling back up. So guess what? When you are sitting at the wheel and your knees are nice and spread around the wheel, you are in the perfect position to do this stretch. Little uncomfortable if you're in a communal setting, but you know, if you're at home and you're in the privacy, but otherwise you can do it at the end of the day. Exercise ball is what I first learned it on, but any chair also works, as well as a stool at the wheel. So. All right, we are going to move. I'm so sorry, this is still, yeah, there we go. We're going to move to handwork, and
Do you want to talk about the mirror?
Yes.
Makeup mirror?
How do you use the exercise ball?
oh, just that'd be a really great way to, well, do the stretch sitting on the exercise ball. And if you catch me afterwards, there's awesome ways to use the exercise ball.
She also has all of these exercises that she is showing and more on her website, so that'll be a really good resource.
And I apologize, I am really into toys for this presentation, but they've been very helpful, and so I don't get any kickback from any of the sales of anything. But all right, another thing that I absolutely have found to be phenomenal in the studio, and this was recommended to me as a way of improving my aesthetics, to work with a makeup mirror. And so imagine that I'm sitting with a banding wheel, and I've got a teapot here. There we go. And I'm trying to place a spout. And so this distance from the mirror gives me feedback, and also on the banding wheel as it rotates, I'm making decisions on where that spout should be placed, and I can get a lot of information from that. And it's actually helped my artwork to become that much better. What I didn't realize until doing this for quite a while is, guess what I'm not doing if I'm looking in the mirror? I'm not contorting around the side of that teapot, and I'm not up close to it. That has been an amazing thing ergonomically, that I can look, you know, with that head balanced over my shoulders. I also have this at the wheel, and so I'm getting that feedback as I'm throwing, and then you're also not doing this to see the side of the piece, or then leaning back and curling back this way to get another angle of it. So that has been just a really lovely, kind of surprising thing that I've added to my studio day that helps my neck quite a bit.
So we're going to move on and talk a little bit about a couple ideas for when you're standing and working, particularly hand building. So one of the issues that often comes with hand building is your arms getting tired because they're hanging out in front of you for a long period of time. Anyone have that? Yeah. I know that I would if I did this. So everyone, just to kind of feel that, because, you know, put your arms in front of you, kind of like a zombie, right? And just hang out there for a few seconds. Da da da, da da da. And notice, probably about now, something is getting tired. Right? So for me, I kind of feel this upper shoulder, and my neck is getting a little tense, so let it down. Right? So we have to find a way to be able to have our arms in front of us, kind of out in space, but not have it feel like, oh my gosh, this is so tiring, right? So the key idea here is that somehow you have to find weight support from the piece that you're working on. Now, I'm not talking about falling into your piece, right? You might be doing something really delicate, but somehow you have to be using that to feed you back into your support. So let's see if we can find a way to do that. So if everyone, this looks like almost everyone can, if everyone can get close enough so they can put their hands just on the chair in front of them somewhere. Great. So we're going to pretend that this is your piece, right? So we can do this two ways. We can kind of do what we tend to do, which is just kind of hang out there and hang there, right? Just kind of see what that feels like. And it can be helpful to stay here for a little bit because it can tell you a lot of information about what's going to get tired over time, right? What's going to happen day after day after day after day if you keep doing it this way, right? So again, so let that down. Did everyone find a place or two that kind of was starting to get tired? Okay. So the other idea, Amy, if you'd stand up for a sec. Great, so she's going to be my piece. Just put your hands out like this, right? And I'm not going to fall off, promise. Great. So she's my piece, and let's say that I have a tool and I'm like this, right? So I can either kind of, I'm hanging out here, right? You can see how I'm starting to kind of collapse, right? Or there's a way that I can just a little bit feel that tool and feel the piece in such a way that it's going to send me back through my arm structure and back through my torso into the ground. It's like, almost like a mini push-up, right? If I were actually to lean, right, it'd be the difference between me collapsing, or using that floor to find my support, right? But here, rather than having, right now I have 10 pounds of lean, I could also have like a gram, less than a gram of lean, and have the same thing, right? So find the chair in front of you again, right? And what you're going to do is you're going to feel the object in front of you, because that'll help you find that connection, right? And then you're going to imagine that as there's just a tiny, tiny, tiny bit of lean, that you can find a way to feel back through your arm. It's almost like, if I made it huge, through your arm, down through your torso to the ground. Yeah. And this way, even if I'm here kind of for a really long time, I can do that, right? Because I'm actually using, in case this imaginary object, I'm actually using it to give me a little bit support back, right? So the second thing that often comes and can be kind of tricky is when you really need to be asymmetrical. So we've talked a lot about you're nice and open, you have the support, maybe there's even spiral, right? But what about the times when you actually really need to be doing something a little different? Like you need to have one hand way up on a piece and one hand way down, and you actually can't do it. Yeah, we're going to talk about it more in loading kiln too, right? So one of the things I like to think about is Michelangelo, right? So if you just kind of call to mind some of his paintings or sculptures, right? Gorgeous, first of all. But also, he always has people in these really, really, really interesting asymmetrical positions, right? They can be leaning, and their body is going this way, and their head is tilted, right? Or they might be reaching out this way, right? So they're in these really funny things, but there's an elegance to it, right? That's what we need to find, right? So one of the key concepts in here is in order to do asymmetrical movement in a way that our body really thinks is yummy, nothing can pull up or collapse, right? So what we tend to do in order to kind of get somewhere is either lift something up. Here's a lift, a lift, a lift, right? A lift. You can see how kind of angular they are. And if I try to take a deep breath here, it's not going to happen, which is a really good indication that this is not something that my body's going to like to do for very long, right? Or we tend to collapse. If I need to get lower, I'm going to collapse my head, or I'm going to collapse my shoulder, or I'm going to collapse my ribs, or I'm going to collapse my hip, right? And again, you can see how it kind of has that funny drop angle thing to it, right? So let's say that I have a piece, and I need one arm to go way over the top, and I need one hand to be way under. Right? There are two different ways that I can do this. One would be kind of lift a shoulder and then put my hand up, right? And then kind of drop something, to bring me over. And then here I am, right? So here I have a couple things lifted and a couple things dropped, and I'm already getting tired and I can't really breathe, right? So instead of that, if I think curves, right, and I can breathe, and very important, right? And I think almost like a drape, like I can feel all the way through my body, and there's nothing that just kind of drops out of the picture. I'm comfortable here. This actually feels pretty nice, right? So there's a way to make asymmetrical movement actually feel really, really yummy and a really nice counterbalance to all of the this kind of motion that you tend to do, right? Okay. We're going to talk a little bit about kiln loading. So we're going to go into some of those things that are really, again, we're just kind of using the same few things over and over and over again. So kiln loading, one of the issues tends to be the weight, right? So one idea there is that weight support, if you can find a way to let's see, I'm holding, this is not heavy, but let's pretend it is, right? I'm holding a shelf or I'm holding a piece, rather than kind of letting that piece pull you forward, finding a way to let that piece send you right back to yourself. Like when I held my baby and toddler, I imagined that I just was bringing her right into my spine. So that extra 10, 20, 30 pounds was just part of me. And then it was easy, right? And the other thing to kind of keep in mind with the weight is the closer to your body it can be, the easier, right? It's just the way we're built. The closer we are to center, the easier it is just to have it be part of our center. And the farther out we get, and particularly if we ever do that, oh my gosh, we're really in trouble, right? So whenever possible, use your legs to get close to lift. Use your legs to go up and down, right? That trifold, right? Lunging, squatting kind of stuff, right? And then use your legs again to move over and get yourself close to where you need to set it, right? Now for wood-fired kilns, the situation is often much more awkward, right? So here we say, let's do our best. So we can, but there are a couple things to keep in mind, right? So one is every time, the more you can have your head on top of your torso, the better you're off you're going to be. So even in a really short kiln where you're having to kneel, you can do that, right? The second one is if you're like kneeling and you can't actually turn and accept the shelf and then turn back, you have to spiral, find that barbershop pole to spiral, right? And then if you need to be asymmetrical, then find a way to do it so that it's actually going through your whole body rather than getting stuck somewhere.
Okay, so I am a wood firing artist, and I noticed that there was a tendency the next day after loading that everybody was complaining about their hips at the studio, especially my buddy John and I were like, why is it just the right side? It's because we've been loading from the left side all day long, and all that weight was grounded on the other side and was really getting weak. And so I had been given a SI joint brace, and I said, well, why don't I go ahead and try that? And it's been phenomenal. And so for heavy lifting and also kiln loading days, this has been really great. So your SI joints, if you think about where your femurs come on up, there's two little sticky-outy points right around here. If you rub them, they're like, oh, they want a massage. So this is a brace that you can wear, and to be more fashionable, you can wear it under your pants. So I usually hide in the kiln shed and put it on, and then no one knows it's on. But you're going to put it over those SI joints, and then you're going to just use the Velcro and go really tight. And then you have these cute extra little bits. Since it was the right hip with that certain kiln that was always bothering me more, this would go really tight in that front area to shore that up more. And then the other one can go not as tight on the other side. But kind of a magical thing, like where it supports the whole pelvic system and makes things feel much more smooth while you're in motion. So that's, again, if that's something that you experience, it wouldn't be for everybody. So. All right, so we're gonna go home now and really enjoy some Pilates at home. And like how to undo a lot of the stresses of the day.
And we're gonna have some time for questions at the end. Yep.
So Rebecca is being very kind for the riser situation in here. She is going to hop up on the table and demonstrate for us. So, and also all of these, what I'm going to show is probably only 30% of what I've put on my website. We're just very short on time, but this is the most important, these are the most important things that you can do with like foam roller and a little kickball and such. So what we're going to talk about here is myofascial release. And what is fascia? This is a beautiful visual. If you are cooking raw chicken and you really want to get a rub under the skin, when you peel it back, there's that white film, and sometimes there's gunk in there. So that is actually fascia, and humans have it also. And so what it ends up being is there's little knots and there's tension in different areas. And so using the foam roller and this small Pilates ball is an excellent way to undo that. It's going to reset the muscles and make things more smooth and more functional the next day. So Rebecca has climbed onto the foam roller, and she has got the bottom of the foam roller under her sacrum. And if she wasn't so tall, she would have all the extra space up top of her head. And she's going to be heavy in through her chest, and she's going to pull her belly button away from the band of her pants to just engage those core muscles. So this right here does a lot. So you do not need to feel like, at first that you need to add anything to this. This is realigning the spine, and any knots up and down are getting released, okay? Now, if you walk around with your head forward posture all day long, she would really want to put a towel pillow under there, and then over time you can unfold it and have it be less of a pillow until you're more comfortable laying there all day long. If this leads you to feel bruised because you've really got some body issues, lay a towel on it as a nice little cushion. So just a couple of things that she can do here is she's going to go ahead and do some nice shoulder circles. So she's just going to bring those arms up and around. And then she is going to go ahead and, after she's done that a while, going to reverse it. So she's going to bring those arms parallel to her torso, scoop around. I'm going to have this in the hallway later if you need this. and then she's going to bring it on back alongside of her. So I might grab you so this isn't too exciting, but she is going to bring one leg at a time up to tabletop. Tabletop in Pilates is where your shins, are you okay? Shins are parallel to the floor, and the knees are at 90 degrees, as is the angle at the hips. And this is going to be a nice, easy abdominal exercise that doesn't strain your neck and shoulders. If this is too difficult, she is going to keep these parallel, but just bring those knees over the torso to carry the weight in. Many, many, many more variations, but let's stick with that for today. Go ahead and put your feet back on the table, and let's carefully come off. All right, and then the small ball, awesome for hip work as well as for opening the chest. So what she's going to do is she is going to lay down with her legs folded, and she's going to press the table away, or the floor away if you're on the floor, and she's going to put it right under her sacrum. And this is just a safe place for the pelvis to be while she's going to do some hip opening. So one leg at a time, she is going to reach up towards the ceiling. And then very nice of her to be willing to demonstrate this. She is going to flex her feet and open wide towards the sides of the room, and then she's going to point her feet and bring them back together. And repeat that a few times. And then guess what? There's all this gunk that's in her hips. So the next time that she goes out, she is going to do little backward circles to work out all that gunk. All right, again, more variations on my website. And then going to press the floor away. We're going to move the ball to under the bra strap area, which is T4 for you technological people. And this is awesome. This is my favorite thing to do with the ball. It is such a lovely chest opening that when you have that under your back and that weight of your head is reaching back towards the floor, that is just such a lovely sensation and such a great way to undo all of that forward shoulder curling that tends to happen. So I don't think we have time to go over rolling out, and it's a little less safe up here. But let me show you basically you're laying on the floor, and this is a great way to roll out the fascia. Main thing to do with, or to remember with this, is to avoid rolling over joints and to avoid rolling over organs. So you would be using the foam roller and rolling out the quadriceps, and you would go the length of the muscle. And then you want to spend more time, wherever there's knots and tightness, you will spend more time on that little area. That just means it needs some TLC, and it'll thank you for it. It should feel like a really good massage. So that's an excellent thing to do. And then the other muscle of your legs is the IT bands. And so when you're laying on the floor and you're rolling it out, start with your hips stacked, and then just angle it forward a bit. You can get some different muscles and some different nice little spots that need cleaning out. And then you can also lean that hip back a little bit and to clean that out.
For some people seem to be interested in the ball. You want to tell them what kind of ball that is?
Yes, so this is a 5 to 6 inch kickball. I like the texture so it's not slippery. It's made by Gopher, and they last a long time. Like when they're in a gym use, they last forever. But Target a lot of times has fine balls. That sounded weird. And if you happen to have an elementary school kid, sometimes that everybody wins ball machine thing, if you have a kid, you know what I'm talking about. Those work too.
So we have about 50, are we done? Oh.
A tennis ball. We need to do a foot massage,
okay.
right?
Yes.
So, yeah, so the last thing we're going to show, and Rebecca is the lucky winner, and I did bring extra tennis balls if you want to catch me outside. Tennis ball is fabulous for rolling out the foot. And so you should leave one where you do dishes, and you should do one where you brush your teeth. And so just under the foot, pretend that it's an inking pad, like an ink ball, and ink the entire foot. How does this feel?
Great.
And spend more time, especially under those metatarsals, to work out any knots. And this is just so fabulous. The foot carries so much of the weight, and it's those 3 arches that really need to be healthy for balance and strength. So don't be shy about spending a lot of time rolling out your foot, because it does a lot for the body. So, just in summary, going back to a lot of what Jim and Laurie said, self-assessment, just keep checking in with your body throughout the day, see what's bothering you, what's not. Have you gotten out of the posture that you were aiming for? And then also, I love Pilates. The reason that I started doing it was because I felt like I had a deep tissue massage after the first time I did it. What you would want to look for in a studio is that an instructor really would modify things for you. So if you've got issues with your neck or your shoulder, that they actually listen to you and they do things that make it doable and beneficial to you. So I really recommend that form of exercise. Rebecca, you want to speak to?
Yeah, and if you're wanting a lot of more individual information for yourself about what your habits are during your work, so that you can use yourself long-term in a way that you're going to be able to do your work forever, which is really my goal with people. Not only forever, but actually enjoy it more and more. Then find a movement specialist in your area. I can speak to the Alexander work, since that's what I do. And that's a study of natural movement and habit. And it also does hands-on work to both give you a better experience of it in your body, as well as to rebalance things. I live here in Portland. But there are, if you look around in your area, there will be people that you can find who really have the specialty, and they can work with you. So we're going to have about just 12, 13 minutes for questions. For the 4 of us, we'll figure out the microphone thing. Oh, yeah.
Yes.
Yes?
I throw standing, and there's an option to throw to, a lot of people will have their pedal with their right, operate the pedal with their right hand, but there's times it doesn't work for me because I want to adjust the speed while I have the hand.
Can I speak to standing and throwing?
Yes,
Okay.
definitely. And then also, just for future questions, this is being recorded right now, audio recorded. So if you could ask the question from the mic, or then if you don't mind, just repeating the question.
Absolutely. So she was asking about standing while throwing and also heavy lifting and how to do that safely. So standing and throwing, it was interesting we hosted a big conference, and so I got to watch a bunch of people standing while throwing. I would say what you could do is switch the pedal from one side to the other, to shift that cord underneath. And also have somebody and this is good advice for everybody, have somebody take pictures of you while you're doing it. Because what I was seeing was that this hip was dropped, and then this hip was up, and this foot was on the pedal, and then the shoulder. And a lot of the upper body was really curled over the work because it was so high up. So, I know that I've seen it done well, but it's a little bit rare, and then do you move more pressure to your feet than not? But those are my thoughts on it, is just definitely have people, take pictures of you and do some self-assessment with that.
I've never thrown standing, but I think we get used to being in a habit that's the thing that's comfortable for you, but it's really a bad habit. So the idea that you have to have your foot on the pedal, you're not constantly changing the speed. So there's nothing wrong with starting the speed, then being with both feet on the ground, activating that core, thinking that you're going to have that internal strength, and then when you need to change the speed, just stop that motion and then change the speed and then go back to the next thing. So many people think that it has to be one fluid step. And in reality, the more that you can take those little breaks or adjusting, the actual better you will be as a human being and a healthier person.
Oh, just one second. There was also the second part of the question was regarding heavy lifting. I would recommend, if you have any pain or tension when you're lifting heavy amounts of clay, is to find someone in your studio to help you out. And yes, that's the harder answer maybe, but we talked about the desensitization earlier, or why you experience pain when you're lifting something heavy, and likely it's because your body is not set up to lift that much weight at this time. So in addition to lifting in the studio, you should probably start working on doing some gradual lifting at home or at your gym. But likely it's just you're probably not strong enough, or you're not using the proper body mechanics at that time. But I would say the easiest thing is to get someone to help you out in the studio, and then also just make sure you're using the different body mechanics that we talked about today.
And the last thing I would say is do it in stages. If it's on the ground, for me to lift 50 pounds from the floor up is really hard. So I actually get down and I lift it to the next layer. Maybe it's a stool, maybe it's a box I put it on. And then I work from the box to the next thing. I don't have to think that I'm going from here all the way up in one motion. If you do it in steps, you're so much more successful.
And not to belabor that any longer, but the closer the object is to you, the easier it's going to be. So bring the clay as close as possible and then lift. Yes?
Yes, how would you load the kiln when you are so short and then the kiln is so high? How would you load the kiln? Do you step on something that is stable, or what do you do? And then how would you use your body to load the bottom shelf?
Well, I like cinder blocks. Yeah, I'll make steps that I can then move away. Yeah. Well, we're supposed to be going to the microphone, people. I'm sorry. That was about how to, if you're short, how to load kilns. Yeah.
I was wondering two things. One was, have you ever tried the SI support band when throwing on the wheel? And then the other question is just adjustments for while you're getting more and more pregnant, like any suggestions?
I have not. I know braces, it's best to use them not all the time, and so I'm trying to use my own body strength most of the time, unless I feel like there's a real issue. Who would like to speak to adjustments while pregnant?
That is a time when they make braces for pregnancy. That is a time that I would probably use that, because especially the bigger you get, and if you're doing a lot of leaning over at the wheel, that's a lot of extra pull. And so there are braces that work to kind of help gather things so that those already really stretched abdominal muscles don't have to work quite as hard. And there's also an interesting way of thinking about being pregnant where you feel or imagine that you could actually bring that weight really into your spine, just like you're lifting a heavy object, which you are kind of constantly, right? So you can either even periodically kind of sit up and take your belly and really gather it into you. And it might feel like, well, it's not really going to move, but it actually does. It'll come back in because it's movable. It's part of you, right? And that can really help decrease the strain kind of during your day.
And I would say that would be a phenomenal time to learn to throw standing.
Right.
Yeah. I'm a sculptor, and often they say work and look at your model and your sculpture at eye height, and that means you're setting a stand up here, and your work is here, and your arms are here for 3 hours at a time. Any advice?
I have.
Well, in graduate school, I got rid of all the tables in my studio. So I worked on the floor, and it really changed. And it's the idea that you change your body or you change the atmosphere. Then when I stopped working on the floor and I was making these 5-foot, 6-foot pieces, and I'm only 5'4", so I actually, again, it's that idea that you raise yourself up. The cinder blocks are fantastic. They're permanent. They don't move around. If you actually have those in your studio, make a little platform for yourself. The other thing is, you can even put like a little rubber pad that's on it. They sell these things at Home Depot. You can get even rugs that have a little foam backing to it. Put that on there. Allow yourself to have a little bit more cushion. Even the person that was talking about standing and throwing, if you have that cushion underneath your feet, you're going to feel a lot more successful.
And one body mechanics piece that I'll mention for having your arms up, and this is the same thing if you're putting something on a high shelf, is what we tend to do when we lift our arms up is to tuck our tail, right? So if you think of, and that again, that's going to cut off all of this support, and you're going to end up using all of this. So the higher your arms get, the more you're going to feel like your tail is reaching behind you. And that'll give you, so that rather than it being my arms and they're stuck, it's going to be giving you all of this support for your arms. So that's one long thing, and that can really help with that.
And that's exactly what I was going to touch on too. Just remember, for every muscle in the body, there's another muscle that does the exact opposite function. So if you're feeling the stress in the upper traps and your deltoid here, there's going to be other muscle groups that likely need some strengthening or likely need some work to help counterbalance that, just like you were saying.
So we probably have time for one more question.
I have a question about returning to wheel throwing after having a hip replaced. I have direct anterior approach, so they don't do a lot of damage while they're damaging you greatly, but they cut one ligament. And I'm wondering how long I should wait, how many months I should wait to allow that ligament to really become strong before I try throwing again. And then secondly, should I just go back to throwing standing and forget trying to throw sitting? Do you have any general advice?
We'll talk for a minute afterwards. I don't want to address any direct medical questions in front of the whole audience, if that's okay. But we can definitely talk further, and we can talk about how far you are out of surgery. But it's a great question because everyone is going to be different with that answer. So everyone's time frame and healing, and based on the specific procedure that you had, is definitely going to change the requirements of what you can go back to. So I'm going to stay. Actually, I think the room is going to be taken, but then I'll be right outside the room also, and we can chat.
All right, thank you so much.
Thank you.